What is the mechanism of Kapha dominant disease? How to identify the pathogenesis in Kapha dominant diseases? This is the topic of discussion in this particular video. Dear ANA community members, press the like button and subscribe this particular video and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. When you think about the Kapha dominant disease, in the sense where there will be the abnormal functioning of Kapha, bioenergy is going to take place. And regarding the different mechanisms wherein the Kapha dominant disease may take place are based on the Mahabhuta dominance, based on the Rasa dominance, based on the abnormal guna increased in the body, depending upon the Vipaka, Virya dominant etiological factors. We can able to identify the abnormal functioning by abnormal karma of Kapha dosha happening inside the human body, depending upon the various clinical features, what we can say Rupa or Lakshana observed in the patients, depending upon the nature of the location dysfunction, depending upon the nature of the initiation of the disease, based on the nature of the samprapti or what we can say pathological events in the patients, and depending upon the decoding the appropriate nidana. These are the different ways where we can able to analyze the kapha dominant disease. Coming to one by one, depending upon the Pancha Mahabhuta point of view, wherein there may be the possibility of abnormal increase of either Pitta, either Prithvi or Up Mahabhuta. There will be Kapha dominant disease may take place in the body. In the sense, whenever a person is going to consume the Prithvi dominant substances or Up dominant substances, there will be the abnormal increase of Kapha dosha may take place in the body. Depending upon the Shad Rasa, it is being mentioned that Madhura, Amla and Labana Rasa substances, they are going to increase Kapha dosha in the body. Whenever a person is going to consume Madhura Rasa substances, there will be definitely the increase of the Kapha dosha, wherein the Amla Rasa, among that where there is Prithvi dominance is more, and in case of the Lavana Rasa, as such, where there will be up dominance is more in the substances, there will be the abnormal increase of kapha dosha may take place in the body. Depending upon the guna dominance, snigdho shito gururmantas lakshno mritsna stiraha kapha, it is being mentioned. Whenever there is the abnormal increase of either snigdha guna or unctuousness, shita, coldness, guru, heavy to digest, manda, slow in action, slakshna, slimy, muddy consistency, and firm. These are the different gunas are being mentioned for kapha dosha. Wherever there is abnormal increase of these guna, for example, if the person is going to consume these substances as such, there may be the possibility of snigdha, guru guna, mritsna guna, sthira guna, and manda guna may get increased in the body. Thereby, there may be the possibility of abnormal vitiation of the kapha dosha or abnormal increase of kapha dosha in the body may take place. Another example, wherein the abnormal increase of kapha dosha may take place. Specifically here, as it is being considered to be the exposure of this particular nidana, what we can say the lassi, is specifically is going to take place in the oral cavity. In the sense, there may be the abnormal increase of the kapha dosha is going to take place in the alimentary canal first. If it is entering via due to the abnormal, what do you say that the diet pattern, if it is entering into the respiratory passage, there may be the abnormal kapha dosha may increase in the respiratory system. In this way, the depending upon the nature of the entry of these etiological factors, there will be the affliction of those different orifices which is going to take place. Here, the Vipaka point of view. Whenever if the person is going to consume Shita Virya substances, like this Kadali, it is having the Shita Virya dominance, there will be Kapha Dosha is going to take place. That is, abnormal increase of Kapha Dosha is going to take place in the alimentary canal first. Virya point of view. Shita Virya, specifically the Shita Virya substances, there will be abnormal increase of the Kapha Dosha. As far as Prakopa Karma point of view, Vagbhata says, Shleshmanah Sneha Kaఠిన్య Kandushitattva Gauravam Bandhopalepastaimitya Shofa Pakyati Nidratah Varnah Shveto Rasau Swadu Labanau Chirakarita. Ashtanga Hridaya Sutrasthana 12th chapter. If you are observing either 1, 2 or more Prakopa Karma, there will be indication that the person is having the abnormal vitiation of the Kapha Dosha in the body. So here, one of the main lakshana that what we can say the Kandu is specifically observed in the lower limb. We can say there may be a possibility of the Kapha Dosha increase in the lower limb. As far as clinical features point of view, what we can see the lakshana. Ashtanga Hridaya says, Shleshmagni Sadana Prasekalasya Gauravam Shvaitya Shaitya Shathangatvam Shwasakasati Nidrataha. Whenever the individual is observed is having 1, 2 or more lakshana, maybe loss of appetite, or maybe the laziness as such, or maybe heaviness of the body parts, or maybe the whitish discoloration, or maybe excessive coldness as such, or maybe excessive sleep, cough, breathing discomfort, etc., then we may say the person is having the abnormal vitiation of the Kapha Dosha in the body. As far as Sthana point of view, Uraha Kanta Shiraha Kuloma Parvani Amashayo Rasaha Medo Khranam cha Jihva cha Kaphasya Sutaramura. Chest, throat, head, then Kloma, what we can say, Pipasa Sthana, what we can say, the site of what is that the thirst, allocation of thirst as such. Parva, joints, stomach, Rasadhatu, Medas, what we can say, the adipose tissue, nose and tongue. If you are observing the lakshana related to these particular sthana, then we may say there may be the possibility of abnormal vitiation of the Kapha Dosha in the body. In the sense, when the clinician has to know or inquire about the dysfunctioning of each of these organs, then only he can able to appreciate the abnormal vitiation of the Kapha Dosha in the body. As far as Udbhavasthana is concerned, it is being mentioned that Amashaya is considered to be the Udbhavasthana for the Kapha Prakopa. In the sense, the person will be developing the lakshanas specifically in the Amashaya. If you are suspecting the disease is considered to be a Nija origin and it is having the Kapha Dosha dominance. Based on the Samprapti point of view, suppose if this is considered to be the Nidana or what we can say etiological factor consumed by the individuals, if the person is going to consume one small bowl, there may be the possibility of Kapha Dosha increase. If the person is going to consume 3 small bowls, there may be the possibility of Kapha Dosha increase. If the person is going to consume 5 small bowls, there may be the possibility of Kapha Dosha increase in the body. But 1 bowl may lead to mild increase, but 3 bowls may increase the moderate increase when compared to the 1 bowl curds intake, whereas but that may be responsible for the less, what do you say, that the aggravation of the Kapha Dosha when compared to the 5 small bowls of curds intake. Whereas the 5 small bowls of the curds intake, so that will be responsible for the maximum vitiation of the Kapha Dosha increase when compared to the 1 bowl intake or 3 bowls intake. depending upon the lakshana, what we can say, the person is having loss of appetite. If this particular loss of appetite is being present for the, what do you say, that 3 or 4 hours, that may be indicative of the mild increase of the kapha dosha in the body. Whereas if the loss of appetite is being present for more than 6 hours or 7 hours, that may be indicative of the moderate increase or vitiation of kapha dosha in the body. Or if the person is showing the loss of appetite for more than 10 hours, that is indicative of severe vitiation of the kapha dosha in the body. In this way, the bala samprapti may be helpful in determining the kapha dosha vitiation in the body. When you think about the upashaya and anupashaya, wherein the person is going to consume the, what do you say, that the mango, that will actually worsen the situation. So that is, mango, if it is considered to be the, what do you say, that the sweet in taste, that will actually increase the situation rather than improving the situation. Whereas consumption of gobi Manchurian, because it is having the Ushna Viryata, it is having the Katu Guna, Katu Rasa, etc. So there may be the possibility of a improvement, or what we can say, the decrease of the kapha dosha is going to take place, or improvement in the symptoms of the kapha dominant disease may going to take place here. As far as Nidana point of view, as we are saying, source of the entry of the Nidana, number of pathogens entering into the body, virulence of the pathogens entering into the human body, they are going to determine the degree of the kapha dosha increase in the body. For example, if the person is going to consume curds, one small bowl of curds, if it is entering via nose, there may be the possibility of the abnormal vitiation of the kapha dosha is going to take place in the nose itself. But if the curds are going to enter into the body via mouth, so this is responsible for the abnormal increase of the kapha dosha is going to take place in the oral cavity and in the alimentary canal. In this way, the source of the entry of the pathogens are responsible for the increase of the kapha dosha here. But number of pathogens as such, when you think about one small bowl, when you think about 3 small bowls, so here, in case of the 3 small bowls, the number of the pathogens or quantity, so that may be much more increased there. Whereas 5 small bowls of curds, wherein the quantity will be much more when you compare the 1 small bowl and 3 small bowls. Virulence of the pathogens here. When you think about virulence, in the sense, if it is a very thick curd, definitely, just like the, what you say, that the very thick curds as such, so that is indicative of the abnormal increase of the kapha dosha is going to take place. Suppose if the curds is little bit butter is being taken, in that particular situation, the kapha dosha may increase to a moderate extent. In this way, the virulence of the pathogens has to be identified. So further, if the curds is having the some amount of the, what do you say, the hingu, etc., the hingu is having the ushna viryata, etc., so that is responsible for the increase of the pitta there. But kapha dosha is going to get a little bit lesser. So like that, the variability of the nidana may be helpful in determining the degree of a kapha dosha vitiation in the body. To summarize, the kapha dosha dominant diseases, the kapha dosha dominant disease may be manifested in an individual because of these various reasons. If there is exposure to the abnormal increase of prithvi and apmahabhuta in the body, if the nidana is related to madhura, amla and lavana rasa substances excessive intake, if there is the nidana, so that is going to get increased snigdha, shita, guru, manda, guna, etc. in the body. If the exposure to nidana is going to take place, so that is having the Shita Virya and Madhura Vipaka. So that then we are going to observe abnormal increase of the Kapha Dosha in the body. How to identify? By looking into the Lakshana of Kupita Karma. It is being mentioned that Shleshmanaha Sneha Kathilya Kandu Shitatva Gauravam Bandhopare Pastaimitya Shofa Pakyati Nidrata Varanaha Shveto Rasau Swadu Lavanau Chirakarita. By observing the Lakshana of Kupita Dosha there. So that is Shleshma Agni Sadana Prasekalasya Gauravam Shvaitya Shaitya Shrathangatvam Shwasaka Sati Nidrata. And when you are observing Amashaya as the initial affliction, wherein we are going to observe the initiation of the Kapha Dosha vitiation starts to occur. You need to observe the other locations of the Kapha Dosha. Uraha Kantha Shiraha Kloma Parvani Amashayo Rasaha Medo Khranam Chajihvacha Kapasya Sutaramura. You need to look into these dysfunctions also. Then, regarding the careful analysis of Samprapti of Kapha Dosha vitiation. So that is in terms of the Bala Samprapti, in terms of the Kala Samprapti, in terms of the Pradhanya Samprapti, in terms of the Vikalpa Samprapti, we have to identify that. Plus, we have to do the careful analysis of Kapha Dosha analysis. So that is the Guru Madhura Rasati Snigdha Dukthekshu Bhakshadra Vadati Jana Nidra Upasarpish Prapuraihi Tuhina Patana Kale Shleshmana Samprakopa Prabhavati Devasadau Bhuktamatre Vasante. These are the Nidana that are indicative of the abnormal vitiation of the Kapha Dosha. If you are observing the either 1, 2 or more among these different parameters, then we may suspect the person is having the abnormal vitiation of the Kapha Dosha in the body. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. That's all for today. Something more in the next video. Thank you.